The reason why we wanted to have a conversation today is we continue to read news about the agreement between ICE and CMS, where CMS is forking over its data to ICE, including identity information, so ICE can identify those folks that are on the Medicaid rolls, potentially to go do customs and immigration enforcement against those folks. Do you know anything about the history of this? Historically, why hasn't HHS shared data with ICE, with customs enforcement?
Well, it's a great question. So before I answer that, I'd love to provide some context for kind of the environment we're in. This is a part of an overall federal administrative strategy to attack the healthcare access for immigrants in this country, many of whom are lawfully present or a critical part of the U.S. workforce and pay taxes. They're weaponizing personal and private healthcare information to further immigration enforcement, something we're about to talk about. They're rolling back immigrant eligibility for Medicaid and Medicare and the Affordable Care Act coverage in the marketplaces through the recent Republican enacted reconciliation bill called OBBBA. And they're just enacted a federal rule that reinterprets the meaning of a 1996 welfare law that makes non-citizens who are not qualified immigrants ineligible for a broader array of health and human services programs, including community health clinics and community behavioral health clinics, Title X family programs. So this is really an overall, I think, concern we have about what's happening, especially to immigrants today in this environment. But it's also important, I think, to answer the question about this agreement that came to light, I think, through the AP article in June about the essentially Department of Healthcare Services, which is the department that CMS, or Centers for Medicare and Medicaid Services, lives within, having an agreement to share information with the Department of Homeland Security or ICE agencies so they could use this for enforcement. But the practice of sharing information between states and CMS has been, up until this administration, a pretty normal practice.